Welcome to Something More with Chris Boyd. Chris Boyd is a certified financial planner practitioner and senior vice president and financial advisor at Wealth Enhancement Group, one of the nation's largest registered investment advisors. We call it Something More because we'd like to talk not only about those important dollar and cents issues, but also the quality of life issues that make the money matters matter. Here he is, your fulfillment facilitator, your partner in prosperity, advising clients on Cape Cod and across the country. Here's your host, J. Christopher Boyd.
Welcome to another edition of Something More with Chris Boyd. My name's Jeff Perry. I'm a financial advisor working for AMR Team and working with Chris Boyd. And Chris has the well-deserved week off here. He's on vacation, so I hope he's enjoying himself, and hopefully I'm sure he'll listen to the podcast. He'll be back next week. I'm really happy to have with us for this episode a very special guest, Jen Mahoney. Jen, welcome to the show.
Thank you, Jeff.
You're very welcome. You are the Director of Care Management for LiveWell Care Management, and I wanted to have you on to talk about a subject that we often think is going to happen to someone else, and that's care after you retire, typically as you get older. And, we always think these things are going to happen to someone else, and we think about them, we reflect on them, but it's something that's really super difficult to talk about and think about and to actually plan for. So you're the expert in the field, and thank you for joining us today. If you just start out by introducing yourself and telling us a little bit about yourself and your company, and we'll go from there.
Yes, of course, Jeff. Thank you so much for having me today. I'm excited to be here and talk about this topic. And so a little bit about myself. I'm a master's level social worker. I'm licensed in Massachusetts and New Hampshire and certified in care management as well as hospice and palliative care. So that's what gives me all those fun letters after my name that when people ask, I just said they could be made up. But they aren't, I assure you. And I have been a social worker and in healthcare for almost 20 years now. And most of that time, or nearly all of that time, has been working with the elderly or senior population. And the bulk of that was about 10 years I worked in hospice. And so now in this position as the Director of Care Management at LiveWell, I've been in this role for almost 3 years now. And LiveWell Care Management rebranded on April 1st of this year, 2025. Prior to that, we were AZA Care Management, and AZA Care Management has been in the Boston area for over 30 years. We have a large team of about 10 care managers, including myself, that are all healthcare professionals that have worked in the field for decades. I think I have the least amount of experience on the team. And we get hired privately by clients and families to help them navigate the healthcare system, which can mean a lot of different things, and we can be very flexible in that way. And so we were excited to switch over to LiveWell Care Management so that our care management offices throughout the country now, we all have the same name, LiveWell. So we have some offices in Houston, New York, San Francisco, and kind of throughout the country in that way. And that's my role. I kind of oversee all of the operations and everything going on in the office.
So you see it all. You see things you expect and things that you don't expect, I'm sure.
Exactly.
So what's the typical, is there a typical client? Is there a typical scenario where people come to you and say, we need help navigating this? I'm a retired lawyer, and before I joined Chris Boyd, I've done a few things. And as a lawyer, I came across so many clients who I did their estate plan for. And then there was a medical issue, and not everything goes as planned, right? So, people who might have had a healthcare proxy in place, maybe that person moved, or they had a power of attorney and that person passed away, or they just never got around to it because there are tough decisions to make. And the number one, you can correct me if I'm wrong, but this is just my narrow perspective. The number one challenge that I saw for people in this sudden healthcare setting, it may not be sudden actually if you look objectively, but they believe it's a sudden situation, is they're just not able to, for physical, cognitive, emotional, whatever reasons, they're just not able to navigate and advocate for themselves in that very complex world of healthcare. And they're almost solely reliant on a system that is well intended but far from perfect. Is that a common thing for you?
Yes, absolutely. I think when, family members call us, they're always surprised, when they say, "Oh, well, I always assumed that this doctor talked to that doctor and they read all those notes and they did all that." And I have to explain to them that yes, in a perfect world, that does happen and providers would like that, but whether it's a time crunch or different systems, there are tons of reasons why that doesn't happen. And that's why it's so important to have that person advocating for you, whether you're able to advocate for yourself or you have a family member to go with you, because it's something that we're all going to need at some point, unfortunately. And in terms of a typical client, I would say we probably have categories of typical.
Okay.
We have a number of clients that come to us. It's usually the adult children calling us and they say, "Oh, well, you were recommended when I met with my wealth manager or my attorney.
Sure. Yep.
And, mom is at home and she's aging and she has dementia and she's starting to need help, but we don't know how much help. We don't know where to turn to. We don't know if she can stay at home safely. She has the funds to stay at home, but we just don't even know where to start and what to do." And, they just need to kind of hand that over for someone to take on so that they can remain involved as a family, and the care manager can kind of take on all of the, when the caregiver is out sick and someone has to run over so the client isn't alone, or make sure that the right medications are in the pill box. It's all of those little things that I think people don't realize the little things can really add up and end up being a lot. So,
And this is magnified if the family member is not local as well. I mean, this can be,
yes.
I've seen cases, and maybe this is typical because I've seen so much of it, where family members are not local, meaning they might call mom every day or every, frequently or whatever, but they just aren't there enough or for a long enough period of time or actually physically there to actually see the warning signs. Like a lot of us as we age are pretty good at covering,
Mhm.
everything's fine. Things are great. Oh yeah. When that may not be the case. So do you find that a lot of your clients or a lot of your children of clients, I don't know how you frame that, but are loved ones who don't live in the vicinity of the person needing the extra help?
Yeah, I would say that's very common. We have a lot of people that, mom lives on the Cape and the daughter's in California. And, for a long time,
Right.
that works fine, via
Sure.
phone calls and checking in. But at some point, you might not realize that, mom doesn't have any groceries in the house, or she's not going to her medical appointments, or, whatever it might be, or the house is in more of a disarray and you know that something must be going on. And so we can kind of become the boots on the ground for that family member and report back to, the family member across the country who presumably is acting as the healthcare proxy and power of attorney. And we can help them in that way. We can bring the client to the appointments. We can follow up with reports. We can make sure that, new medications are picked up and, groceries are in the house, just anything from, healthcare related to, any other needs as well. So I would say that's a huge category for us, as we see a lot of people that do live in this area and then, their loved ones have moved away over time.
Sure.
Or even if they're just out in Western Massachusetts, that's a few hours away. That's not,
Right.
Running over to, bring someone milk or something like that. That's still quite a distance. So we get called in for those sorts of situations all the time.
So let's talk about that situation. So if you're down here in Florida, like I am, and I had a loved one back in Massachusetts, when do I call you? Like, what's the right time to call you? Should I be calling you before this is needed? If my loved one hits 90 and everything's fine, should I be checking in and doing some planning, or are there other signs? You mentioned few, but are there other things that would trigger that? What's ideal?
So ideal is for people to pre-plan and to get us involved before they need us.
Yep.
And to meet that demand, we do have what we call our Peace of Mind program. And it's basically before you need the active care management and you're assigned a care manager and you pay a small annual fee and the care manager visits quarterly. and just basically gets to know you. So they'll know, okay, your son is the healthcare proxy, Jeff, he's in Florida. We have his phone number. We'll have a conversation to introduce ourselves, and, just kind of becoming enmeshed in who the person is, how they're doing, so that we're ready to act and already familiar with the person and familiar with the house. So we know that, if there's a mobility issue after the hospital, can they return home, or do we have to bring in, grab bars or whatever other equipment there is. So that would I'd say be our preference, of course. Now I would say most people, take in the information before they need it, and don't necessarily act until they do need it. And I think that's because a lot of people who haven't been through this don't realize how much it can really become, because this is something that family members do all the time for loved ones. And
Sure.
But it takes a lot. And, especially if you're further away and you're not able to, run over to the ER or take mom to the appointment or something like that. So we can also, I would say the bulk of our clients, we get involved when there's a new diagnosis, maybe a new hospitalization. There's something going on, that prompts them to say, okay, I think we need care involved, or we need some guidance, or, it's almost like they know that the family knows that something is needed, but not even sure what and how much and where to go to. But they know that it's related to the healthcare. And, oftentimes we get people who want to remain at home. And so that's where we can come into play, because we can help them, locate the right resources and oversee the caregivers in place and everything like that. So ideally ahead of time, but realistically, it's not.
Well, the other benefit from my point of view of the early inquiry is that you get the caregiver, your team, gets to build a relationship with the loved one. And so when it is time for heavier involvement and more detailed assistance, it's like almost like a friend or someone you're familiar with. It's the adoption, or the willingness for the loved one to receive the help must be tremendously increased by having that relationship prior to someone meeting them in the hospital, for example.
Yes, absolutely. And that ends up being extremely helpful. The flip side of that too is that if the families want us to be involved, sometimes the individual themselves are not open to it.
Oh,
and they
I've
aren't
seen
ready
that.
for it.
I've
And,
definitely seen that.
that's another element and curveball that gets added to the scenario as well.
Yeah, it's almost for some people, and I want to talk about the people who call on their own, but in the scenario we're talking about, for some people, I've seen it become almost adversarial between the person, the social worker, or the person trying to provide assistance, and the person needing assistance. They don't view it as help because they're not ready for it. So anything done before, whether it's financial planning, estate planning, care planning, it's really a gift to do it before, for so many reasons. But there are those people who actually don't have anyone, right? So they've lived their whole life alone, or they've lost their spouse a number of years ago, and they don't have someone that they feel they can count on, or the famous verbiage is, I don't want to be a burden. I'm not going to call my daughter in Georgia because I don't want her to worry. I'm not going to call my son in Kansas. I don't want him to rush out here. He's got his own life. So if someone's in that situation, what's your best advice when maybe they should call and say, can you help me?
Yeah, I would say those situations, it's definitely very beneficial if they're open to the care management, for the reason, like you mentioned, the relationship building and really getting to know that person. So it's not, a stranger coming in bedside that, you're meeting in the hospital when, you just had a bad fall and you're a little disoriented, and you haven't talked to the family before and everything like that. So it's definitely helpful to put that in place ahead of time if the person is open to it. Most of the time we see that, whether it's the adult children or the client themselves, but there's some resistance to some level there. And we meet that a lot, and we deal with that a lot, and can deal with that. And one of the ways that we deal with that is actually, I tell family members all the time that sometimes hearing the same thing that your daughter might tell you, hearing it from a professional sounds different to people.
Right.
Because regardless of how old you are, you're still the son or daughter. And to hear it from a professional, other times we'll get the doctor involved, because to hear it from the
Right.
doctor is really
Right.
helpful as well.
Absolutely.
And so we try to use all those little tools to get the people the care that they need to remain safe, and help them understand that we're on their team, and that we want them to remain independent, but safely independent. And what does that look like, and what do they want?
So as far as the scope of services that you might provide, if someone is living alone or there's a family member, either side now, and there's at least an agreement between the family that maybe mom, it's usually mom, maybe mom needs to go to some type of other residential setting. Do you help with that? Because I know I have friends who work in the industry, and they're two close friends, and they're very, they're friends. They tell me the truth, and there's very different types of facilities out there, and there's different types of aggregating sites that you might see on TV that really are just kind of a referral service to a feeder institution. So it's the system, if you will, of moving on to that next residential setting isn't as uniform as people might think, and it's not always designed for the best interest of the resident. So is this something that you help, like location, quality, cost, like?
Yes. Yep, we help with all of that. When that typically happens, it's usually, after the person's been at home, because their first goal was to remain at home. And then, someone along the lines decides, okay, we want to, move this person, or the person themselves wants to move. And then, from there, we can assess their level of care to figure out, okay, do they need independent living? Is it assisted living? Is it memory care? Is it nursing home care? To figure out where we're looking, because then we can kind of break down, okay, what are you looking for? A lot of people like the idea of the large campus, the continuing care retirement community, where you have almost all of those levels of care. And, that's very beneficial, because then, you're going off campus if you have to go to the hospital, but then you could be using the nursing home back there. And, you're already in the system and familiar with people, and, you're going to be on a different wing or in a different building, but it's still the same system. And then there are other people who, have other things that are important to them. Sometimes it's strictly based on geography, and, you want to make sure that it's fair between the two children so that everyone can get there. And so you're picking a place, off a highway that has a lot of good, levels of care. That another one that we deal with a lot is married couples that come to us. And, so married couples can many times be at different levels of care. Maybe one person is independent living and the other person is nearing memory care. And so they really need assistance. And so, we're familiar with facilities. Most facilities would have only one level of care per room, but there are facilities that do have, you can have a married couple in the room where one is independent and one is assisted living.
Okay.
And, so you're able to keep the people together that way. Then there's other married couples that, whether it's the disease process or just the personalities, where the family says, no, we want to separate them. And, so we're just used to taking whatever the situation is and finding the right fit. And we're very familiar with all of the facilities in the area. Fortunately, there are tons of different facilities in this area, but at the same time, for families, unfortunately, there are so many different facilities in the area that you don't.
And how do you know, as a one-time consumer?
Exactly. Exactly. So you don't know, the reputation and what's important to that facility, and, the, religious affiliations and all of those things, come up, and then we locate the right place for them. We'll set up the tours, we'll bring them on the tours, and, really make sure that it's the right fit for them before they move there, and talk about the future of, okay, if you decline, then you can move to the assisted living here. But if you had to go to nursing home, you'd have to go to another location. So that would be another move. And, kind of weighing all those different options and moves and everything that goes into it.
So your services don't end with that placement, I would assume.
Correct. Yeah.
Because one of the problems, I'm glad that you said that, because one of the problems that I see from, well, not from my own experience, but from my friend's experience, is that someone will move to say an assisted living facility that just has assisted living, and that their level of care was fine for a while, and then it isn't. And
Hmm.
the facility, I'm told, isn't always eager to move that person along because it means that person's leaving their business,
Hmm.
right? And so the level of care isn't always matched up to what they're getting to what they now need. Is that true in your experience?
I think that facilities definitely try to be very transparent with
Mm,
people. I think there can be resistance on both sides for different reasons.
that's fair.
Um,
Yeah.
and I would say, and that's why you mentioned, do we remain involved when the person moves? And we do. We certainly prefer to, but it's always up to the family. If they say, okay, we're all set, then we'll certainly end services. But we like to be involved because a lot of times families don't realize that, the assisted living or wherever you're moving mom, they can handle a lot. They're there
Sure.
24/7. They'll
Sure.
handle all their needs. They'll, their meals, activities, everything like that. But, let's say, mom's in a facility in Newton and all of her family is in Florida,
Mhm.
and, she's running out of, clothing. She needs summer clothing, and it got lost in the laundry. Or
Right.
more importantly, she's heading to the ER, and they're not able to send someone from the facility because it's
Right.
just physically impossible, unfortunately. And those are times where having a care manager that already has a relationship and can go into action for the family, it ends up being really beneficial for those sorts of things that you don't really think of and don't come up every day, but
Right.
it's helpful to kind of have someone in the background for that.
Yeah, absolutely. I've been pigeonholing you into certain areas, not on purpose, but why don't you share with other opportunities or places that your company provides services that we might not be talking about so far?
Yeah, so I would say in care management, the bulk, just the fact that we deal with healthcare, and oftentimes healthcare becomes more complicated as we age. And so the bulk of our clients end up being, the older adults, but we do also deal with, adults and younger people. So we've had a number of people that have mental health disorders that we're helping them manage their care, and they just need a little more guidance and a little more hand holding,
That's
and we're
great.
able to help them with that. We've also had a number of couples that are aging come to us, and they don't need help yet, but they have a child with autism that's in
Mm,
their 20s or 30s. And they have support and they have services and they have a sibling to serve as the healthcare proxy. But mom and dad have essentially been the care manager and
sure.
have all these binders from decades of, doctors and
Right.
treatment and follow up. And they want to be able to hand that off to someone. And so that's where they end up bringing in a care manager to eventually, kind
That's
of take
great.
over for them and help them in that way. So, it ends up being more of the older adult population, but it's not strictly the, older. Anything with healthcare related needs, we're able to assist with.
No, that's I hadn't contemplated that, but if you do have a child in your care that needs lifelong care after you're gone,
Right.
sometimes a professional is the best option.
Hmm.
In the beginning, Jen, I talked about advocacy and maybe a hospital setting. How deep does that go? Can someone who is doesn't have someone to name as their healthcare proxy, which surprisingly, as a former lawyer, I was surprised by the number of people who would say, "I have no one. There's no one I want to trust with this." Is that a role that your company takes on?
So it can be. We're very careful about that
Sure.
role. I would say that we usually will ask the person, okay, well, is there, because oftentimes they think, the person has to be nearby them. And,
Right.
so we had one that we took on recently that she said she had no one. And it turns out she had a sister in Italy.
Mm,
And yes, that's not ideal, but
right.
if we're aware of the time difference and all of that, that person can still be the healthcare proxy, and we can be the person, the boots on the ground, guiding them and educating and supporting them along the way, so they're more comfortable with the decision making in terms of the decisions that they have to make at that time. I would say that it's never a hard no. It would depend on the circumstances. We definitely want to give people the resources that they need. And there are also a couple of resources out there for people that either are in need of a power of attorney via professionals or healthcare proxy. So we can definitely take those individuals and kind of figure out, like, undo the layers and figure out, okay, who can we have? Would it be us? And, because we always want to make sure it's not a conflict of interest. So it's on the rarer side that we will serve as a healthcare proxy, but it's not an impossible ask.
Well, I think the best thought about that is there may be someone that you individually think that you don't have someone, but the assistance from a company like yours or a good estate planning attorney or a financial advisor is to help walk them through that, because there could be someone that you're just not reflecting on, so that's good advice. We're just about running out of time, Jen. Am I missing anything? Is there a question I should have asked you that you wanted to answer, or information that you wanted to depart on our listeners?
Well, I will say that I don't think I mentioned our territory to start. So the territory is very important because that's where we're familiar with the resources in the area. And so right now our team covers from southern New Hampshire, basically Manchester and south, all of eastern Massachusetts, east of Worcester, and Cape Cod. So we cover a pretty big service area, and our care managers live throughout that territory. And so we can assign someone based on, geography and what they're looking for and what their needs are and everything. And we do also have a care manager on call 24/7. So, most of the time you're dealing with that one person, even if it's weekends, care managers usually prefer to get the calls themselves because they're the ones who have the relationship.
Sure.
But let's say a client goes to the hospital in the middle of the night and the ER physician needs to talk to someone, they can call, and they can always talk to a care manager that can log into the system and, figure out whatever it is that they need and guide them through that.
Great. Well, it's been a very informative half hour. How do people learn more about you if they'd like to check you out?
Yeah, absolutely. So we do have a website. It's www.livewellcm.com. Or people can feel free to email me at jennifer.mahoney@livewellcm.com. And then, of course, you can always call our office at 617-254-9800. And, I'm happy to talk on the phone with people that, just have questions. There's no obligation to sign up by any means. I'm happy to talk to anyone.
Well, that's great. I'll put that information in the show notes. So if you're listening and you missed that, you can look at the description of the show, and Jen's contact information will be right there. Jen, thanks so much for your time. Thanks for what you do. It's a valuable service, and I would encourage people who think they might need it to check you out.
Thank you so much, Jeff. I appreciate it.
And thank you for listening to another episode of Something More with Chris Boyd. Chris will be back next week. Until then, keep striving for something more.
Thank you for listening to Something More with Chris Boyd. Call us for help, whether it's for financial planning or portfolio management, insurance concerns, or those quality of life issues that make the money matters matter. Whatever's on your mind, visit us at somethingmorewithchrisboyd.com or call us toll free at 866-771-8901. Or send us your questions to amr-info@wealthenhancement.com. You're listening to Something More with Chris Boyd Financial Talk Show. Wealth Enhancement Advisory Services and J. Christopher Boyd provide investment advice on an individual basis to clients only. Proper advice depends on a complete analysis of all facts and circumstances. The information given on this program is general financial comments and cannot be relied upon as pertaining to your specific situation. Wealth Enhancement Group cannot guarantee that using the information from this show will generate profits or ensure freedom from loss. Listeners should consult their own financial advisors or conduct their own due diligence before making any financial decisions.